So here we will be discussing some topics of the head and neck, and as a continuation of the last session, which we discussed about the thorax and then the topics related to the thorax. So if you want to recollect, we can see we have seen that we have seen the mediastinum, blood supply of the heart, and then external features of the heart, external features of the lung. So today we'll be discussing the something about the head and neck, and then we'll continue with the some important upper limb and lower limb. Okay. Now in head and neck, most of the questions are related to embryology. Some questions are related to embryology, and some questions are related to the neuroanatomy part. If time permits, we'll see the neuroanatomy, or we'll see the neuroanatomy in a more session, a separate session. Now, cranial nerves are one of the commonest questions asked in case of head and neck. Okay, I think you must have learned as a separate neuroanatomy, but in FMGE it is separately head and neck, and then neuroanatomy, cranial nerves are included in the head and neck, and they are included as a part of head and neck also and neuroanatomy also. We will be discussing both. They are included as a part of head and neck also and neuroanatomy also. We will be discussing both in the head and neck and neuroanatomy. I will see a question first. Okay. A patient has undergone an extraction of the third molar tooth, and post-surgery, the patient is experiencing loss of sensation over the anterior two-thirds of the tongue. What is the question? The patient has undergone an extraction of the third molar tooth. It's called the wisdom tooth. No, usually it appears after 23-25 years. Okay, we'll get wisdom by 23-24. So that age, some people it may not come also. Now if it has been impacted, usually we will take it out. That is called extraction of third molar tooth. Post surgery, the patient is experiencing loss of sensation over the anterior two-thirds of the tongue and the floor of the mouth. Anything related to sensations means we need to know about the nerve supply. It's not about the arterial supply, it's about the nerve supply. Which nerve is affected in this condition? The answers are accessory nerve, lingual nerve, inferior alveolar nerve, and hypoglossal nerve. Okay, before going to this, we'll just see a quick thing about the cranial nerves of the body. So how many cranial nerves are there? A quick recap, and we have got 12 cranial nerves, 12 pairs of cranial nerves. The first cranial nerve is what? Okay, olfactory nerve. Second is optic nerve. Third is called, I'll give you a trick to remember this, oculomotor. Okay, 4, 5 will keep it separately just to have an idea about this. Both okay, fourth is called what? Trochlear nerve. Okay, then sixth is abduction. Fifth is called trigeminal nerve. Seventh, we got facial nerve. Eighth is vestibulo. Okay, and ninth, we got, what is the ninth nerve? Then we got 10th nerve, 11th, and 12th. Okay, the 10th is vagus. So now I'll just give you an idea about this. This is 12th is hypoglossal. Glossopharyngeal. This is called accessory nerve. Okay, 11th cranial nerve is accessory nerve. Now first, how they named all these nerves? Okay, when you see the brain, or when you see the base of the brain, you must have seen that this is the base of. Now all these nerves are emerging like this. These are called cranial nerves. Why they are called cranial nerves? As such, they are called cranial nerves because they are emerging from the cranial cavity. These are nerves which are coming out of the cranial cavity is called cranial nerves. How they started naming? You see that the first nerve which is coming out from here, from the anteriormost part, will be the olfactory nerve. The last nerve almost will be the hypoglossal nerve. which will be coming out of the hypoglossal canal. So they started naming like this. It was not randomly named, it is in a sequence. Okay, sequence of appearance from anterior to posterior. In other words, rostral to caudal. Okay. Now, what is olfactory nerve? Olfactory nerve, just see the function, then we'll see the other parts. What is olfactory nerve? Olfaction is the sensation of smell, because we got nose, which is there in the first part. Above that, we got sensation. These nerves will directly come from here, and if you have a nose here, this nerves are directly emerging into the olfactory nerve. First is the olfactory nerve. Then optic nerve is related to the vision. We got two optic nerves, right optic nerve and left optic nerve, which will form the optic pathway. Why I put 3, 4, 6 together is that 3, 4, 6 are related to the eyeball movement. The 3, 4, 6 are related to the eyeball movement. Third is already given a name, oculomotor. What is ocular? Ocular means orbit. Ocular means orbit. So oculomotor is a main nerve that is concerned with the movement of the eyeball. Which is a main nerve that is concerned with the movement of the eyeball? That is oculomotor. Okay. We also got a trochlear nerve. We also got abducens nerve. Trochlea means pulley. Okay, this nerve usually will appear as a pulley. Okay, that is actually superior oblique. It will supply a muscle called superior oblique that will pass through a pulley. That's why this is called trochlear nerve. Okay, then we got abducens nerve. This is also a nerve which will supply the lateral rectus muscle. Okay, so commonly known mnemonic is SO4 LR6. Superior oblique is supplied by the fourth nerve, LR6. Lateral rectus is supplied by the sixth nerve. All others are supplied by the oculomotor. Oculomotor except superior oblique SO4 LR6. We don't know, just remember this mnemonic. SO4, superior oblique by fourth nerve, that is trochlear. Lateral rectus is by sixth nerve, that is the abducens. All others are supplied with the. So 3, 4, 6 together is responsible for the oculomotor. What is the sixth nerve? Sixth nerve is trigeminal cranial nerve. Trigeminal nerve. Why it's called trigeminal? It has 3 divisions. This trigeminal nerve will have 3 divisions: ophthalmic division, maxillary division, mandibular division. Okay, trigemina, 3 gemini. Okay, 3 nucleus, 3 branches are there. From the trigeminal nerve, one will be supplying the near the. It is not supplying the eyeball. It is supplying the skin over the, that is called the ophthalmic branch. Then we have maxilla. Maxilla is here. That is the chin. Then we got mandible, which is there on the lower part. So skin of the face is supplied by the trigeminal nerve. Optic nerve is concerned with the. This is concerned with the eyeball movement. Trigeminal nerve is concerned with the sensation of the face. Okay, touch sensation of the face is supplied by the trigeminal nerve. Ophthalmic, maxillary, and mandibular. It has some motor supply that we'll see with the cranial nerves. Then what is the use of this facial nerve? The seventh nerve is called facial nerve. Already face general sensation is already supplied by the trigeminal nerve. What is the use of this facial muscle is supplied by the. So motor supply of the face is given by what nerve? It is the facial nerve. It is not the general sensation. It is the motor supply. So what motor we are using? So we'll be using some smile sensation. We'll be grimace, sensory output like facial or facial muscle. They are called muscles of facial expression. These muscles of facial expression are given by the facial nerve. Okay, nerve supply of muscles of facial expression is by facial nerve. It also has some more additional branches to the glands and some other features also. It will supply the internal ear also. That part is already there, but main supply is by the muscles of facial expression. Now, what is next 8th cranial nerve? Vestibulocochlear. What is vestibulocochlear? Vestibular cochlear is called balance. Okay, it has 2 parts: a part for the balance, a part for the hearing. You are all hearing in your class, hearing my class by your cochlear part. Okay, so the nerve of hearing is cochlear part of vestibulocochlear. Now, what is vestibular part? Vestibular part is balance. Okay, imagine that if you are just turning around, you will feel giddy. No, why? Because your vestibular apparatus is there. It has some semicircular canals, anterior, lateral, and posterior semicircular canals. There is a fluid inside that semicircular canal that's called endolymph. If there is a balance is affected in the semicircular canals, you will feel giddy. Okay, so the sensory output or sensory information from this semicircular canal is taken by a 8th cranial nerve that is called vestibular part of vestibulocochlear nerve. Okay, now the 9th cranial nerve is called glossopharyngeal. What is glossopharyngeal? The glossopharyngeal part is the one which is supplying the tongue and the pharynx. The glossopharyngeal nerve supplies the tongue and the pharynx. Glosso means tongue, pharynx is pharynx. Behind nasopharynx, oropharynx, laryngopharynx, 3 pharynxes we have. That part is supplied by the glossopharyngeal nerve. Okay. The 10th is called vagus nerve. This is the only cranial nerve that will come all the way down to the GI tract. It's called wanderer's nerve. Okay, why? Most of the cranial nerves are related to head and neck only. It will not come below this neck part. Okay, but vagus nerve will go inside the thorax. It will supply the heart. It will supply the lungs. It will form the pulmonary plexus. It will form the cardiac plexus. It will supply the stomach. It will supply the small intestine. So it's always wandering inside, wandering down. That is, it's called wanderer's nerve, called vagus nerve. Okay. Next is called accessory. Why it's called accessory nerve? Now this nerve is a peculiar nerve. It has a spinal part and a cranial part. The spinal part will come down and supply the posterior triangle of neck and supply two muscles, sternocleidomastoid and trapezius. Sternocleidomastoid and trapezius are supplied by the spinal part of accessory nerve. A cranial part will go inside and go and branch along with the vagus nerve. So accessory nerve, it is just an accessory. Accessory means additional. It has two accessory. We have a spinal part of accessory nerve and cranial part of accessory. Cranial part of accessory will come out and go back. It will come out of the cranial cavity and then go back and join with the vagus nerve. This spinal part of accessory will be there on the posterior triangle of neck by the trapezius and sternocleidomastoid. Two muscles will supply. That is the accessory nerve. Now last is hypoglossal. What is hypo? Hypo means below. It will supply it. This is a nerve. It is not below. It will go below the tongue and then it will give the motor supply to the tongue. I am talking because of my hypoglossal nerve. Why? Because the hypoglossal nerve gives the motor component of the tongue, is by the hypoglossal nerve. So this is a general view of all the cranial nerves. Okay, if you don't know, if there is any question related to the function, try to correlate with the cranial nerve. Okay, foramen cecum. Foramen cecum. What do you mean? Any pouch, cecum is there in the intestine also. Cecum means blind pouch. This foramen will stop here. It will not be a canal. Okay, this foramen cecum will stop. That is why it is called a blind pouch foramen. This is called foramen cecum. This is also can be an MCQ. What is foramen cecum a remnant of? It is a remnant of thyroglossal duct. Thyroglossal duct. The thyroid gland in the neck actually form as a canal, that is called thyroglossal canal. Then it will be forming the thyroid gland. At the end of this, there will be a formation of thyroid gland. After this formation of thyroid gland, this canal is cut off. Okay, so there will be a remnant there. That remnant is called foramen cecum. So it will form a remnant here. This remnant is called foramen cecum. Now, what is the name of this line here? It's called sulcus terminalis. Now, if we divide them into anterior 2/3, posterior 1/3. Okay, the sulcus terminalis divides the entire tongue into anterior 2/3 and posterior 1/3. We also have a posterior most part even behind that. Okay, so tongue is divided into anterior 2/3, posterior 1/3. If you see from the lateral, this is the anterior 2/3, this is the posterior 1/3, and this part is called posterior most part. Okay, why? There is nerve supply, there is a change. That's why we are covering it under different condition. Okay, so anterior 2/3, posterior 1/3, and posterior most part. Okay, now what is the nerve supply of this anterior 2/3? In embryologically, all this are developing from different areas. So if they develop from different areas, they will be having different nerve supply. Okay, we'll talk only about the general sensation here. Now, general sensation of this ant supplied by, we'll see that in that. It is supplied by a nerve called lingual nerve. So lingual nerve will supply the general sensation of the anterior 2/3 of the tongue. Why? Because lingual nerve is actually a branch from the 5th cranial nerve. Okay, lingual nerve is a branch from the 5th cranial nerve. Mandibular division of, I told you, ophthalmic, maxillary, and mandibular. No, the mandibular division will give a branch that's called lingual nerve. Lingual means tongue. It is supplying. The general sensation is taken by the, you see the peculiarity. 5th cranial nerve supplies the general sensation. Taste sensation is carried by the chordotympanic branch of facial nerve. Now, posterior 1/3 of the tongue and posterior most part They are different. The posterior most part of the tongue is supplied by vagus nerve. Supplied by vagus nerve. Posterior one-third is supplied by the glossopharyngeal nerve. Glossopharyngeal nerve. What is glossopharyngeal nerve? It is the 9th cranial nerve. Vagus nerve, what is vagus nerve? 10th cranial nerve. You see, tongue itself 5, 7, 9, 10. Tongue is supplied by 5, 7, 9, 10. Fifth nerve is supplying general sensation. Then taste sensation of this part is supplied by the chorda tympani branchification. Now, posterior one-third of the tongue, they say like both general sensation and taste sensation is carried by the glossopharyngeal nerve. Posterior most part of the tongue is supplied by the 10th cranial nerve, that's called vagus nerve. This vagus nerve has one more significance. This is called gag reflex. In physiology, or you will see some reflex, no? You'll read some reflex. The gag reflex. Gag reflex means sometimes if you put your finger onto the, we have feel indigestion, some people trying to do that. They will put it on, or something is touching on that, you will feel a gag-like sensation or vomiting sensation. Why? Because they are touching on this posterior most circumvallate papillae. The papillae here is called circumvallate papillae. It is a histology question. This is called circumvallate papillae. So this is gross anatomy question. This is an embryology question. Foramen cecum is a remnant of thyroglossal duct. Gross anatomy wise, these are the topics related to the tongue. We'll go back to the question. Again, they have taken out the wisdom tooth. What is that? So why this is lingual nerve is affected? Because lingual nerve, inferior alveolar nerve is also may be damaged, but it will supply only the lower jaw. Okay, if they given in the option, given in the question that the sensation on the lower jaw is affected, the patient is not feeling the pain, feeling any sensation on the lower jaw, you should put an inferior alveolar nerve. It's a branch from this lingual which is supplying the lower jaw. But what they have given is that experience loss of sensation. You see, there is no loss of taste sensation. So always look for the catch here. The clue is the loss of sensation. Sensation means general sensation. Anterior two-thirds of the tongue is affected as well as from the floor of the mouth. So the nerve, answer is lingual nerve. What is the accessory? Accessory is the 11th cranial nerve. It is not related to this. Inferior alveolar, if they have given the option, given the question, lower jaw sensation, we can take this option. Hypoglossal nerve. So what could be the question in the hypoglossal nerve? If they are given in the question, the person is experiencing slurring of speech because hypoglossal nerve supplies the motor component. Okay, if motor component is not there, what the patient will have? The patient will have like he cannot talk properly. That's called slurring of speech, and there is a deviation of tongue to one side. So that if there is the option, you have to take the hypoglossal nerve as an option. Okay, so always try to read the option so that you will have an overall idea. Don't read only one question. So one more thing I want to say is that any MCQ exam, clarity is most important thing. Okay, don't try to read everything and remember nothing. It's not the person who has learned 500 things who will succeed in any MCQ exam. If you have learned 200 things, learn it to the clarity. So those who have the clarity, I know that you have to learn the 500 topics, but have a clarity of concept in the 200 topics, then gradually increase it to 250, then 300, then 500. These are the fellows who will definitely get the rank. Okay, it's not the person who has read everything, all MCQ books, who is not going to get the top ranks. Okay, if you want to aim for the top rank or any rank in the NEET PG or FMGE, so try to get the concepts clear, have a clarity of the concepts. This I want to say. I thought I'll say in this. Okay, so we have learned about something about the cranial nerves and something about the related to this thing. Now there is a favorite topic for all FMG and next PG, that is the facial nerve. Okay, we will see a facial nerve question. A 45-year-old man presented with painful swelling behind the right ear. He has inability to close his right eye and difficulty in chewing the food. Which nerve is commonly affected? It's also same option but slightly different option. Or there is a nerve called auriculotemporal. Since there is a thing related to the ear, it's auriculotemporal nerve. Then facial nerve, it's a 7th cranial nerve. Inferior alveolar, greater auricular. So auriculotemporal and the greater auricular, all are branches of this trigeminal. Okay. Facial nerve is a separate nerve, that is a 7th cranial nerve. Now, facial nerve, a commonly given palsy. That's called facial nerve palsy. What is facial nerve palsy? Is called Bell's palsy. Okay, so I've just drawn a schematic diagram for Bell's palsy. Bell is the name of the surgeon who has described, or a physician who has described this condition. It's called Bell's palsy. Now, you see in this half of this face, I'll just, okay, if you see on the, there is a right half of face and there is a left half of face. So just see on the left half, everything looks symmetrical. Okay, right half will look like old age. Okay, the same person who is having a left side facial, everything is normal, right side facial features are there. Now, what are the features of this Bell's palsy? Before that, what is Bell's palsy? It is a lower motor neuron type of palsy or paralysis. Lower motor neuron type of paralysis. Now, what is upper motor neuron? What is lower motor neuron? You have to have this clarity in the concept. What is upper motor neuron? What is lower motor neuron? Then we'll come to the features. Okay, what is upper motor neuron? What is lower motor neuron? Okay, now maybe I will try to explain in a separate slide so that, okay. In simple terms, we got the brain here. Okay, we got the brain. I will cover again this topic in, then we got the spinal cord. Okay, we got brain and spinal cord. Now, if we have any lesion, the cranial nerve nucleus, okay, the nucleus of the cranial nerves are there in this cranial cavity. So, they are called cranial nerve nucleus. Okay, this cranial nerve nucleus, if anything happens, imagine the facial nerve cranial nerve nucleus is here. Okay, nucleus is there. So, before that, what is a nucleus? What is a ganglia? Now, you have seen that this is neuron. No? You must have seen this diagram. Okay, the structure of a neuron, and these are the process. Okay, what is this part of the neuron? This is called dendrites. This is called axon, cell body, axon, then axon terminals. Okay, now if we have the collection of this cell body, so focus here, the cell body collection within the CNS. So what is CNS? Brain and spinal cord. If we have the collection of this cell body, I'm not talking about the axon, I'm not talking about the dendrites. So I'm talking only about the cell body. If you have a collection of cell body here, here or here, they are called a name called nucleus. This is not the cell nucleus. This is the neuroanatomical term called nucleus. If we have a cell body collection outside this, for example, sympathetic ganglia, parasympathetic ganglia. So if you have a collection of cell body outside this CNS, it is called what? Ganglia. So what is ganglia? Collection of cell body outside the central nervous system is called ganglia. Within the central nervous system, it is given a term called nucleus. Okay. Now the cranial nerve nucleus are there, and here also we have got motor nucleus within the spinal cord. Okay. So this nucleus will be there in the spinal cord also, will be there in the inside the brain. They are called cranial nerve nucleus. Cranial nerve nucleus will be present inside the brain. The spinal cord also has some nucleus. Okay, that we'll see when we see the neuroanatomy part. Okay, now our aim is to explain what is upper motor neuron, what is lower motor neuron. Okay, now the brain is sending all the signals in the spinal cord. If we have the spinal cord is like this, a head-shaped part. Okay, now from the brain, all these things are coming, and then they will relate here. Then it will go out. So this is called anterior is motor, posterior is sensory. This is motor part and this is sensory part. Okay, and we got the nucleus here. Then it will go out. This will go out. Okay, posterior is sensory going inside, anterior is motor going outside. This will go as spinal nerve. Now, if we have any lesion outside this neuron, okay, outside this nucleus, this is called lower motor neuron. From the brain to this part, after this, if there is any lesion, for example, we can say that radial nerve is cut, or axillary nerve is cut, ulnar nerve is cut. They are nothing but the spinal nerve is cut here. So if this cut here or some tumor is compressing, that lesion is called lower motor neuron type of palsy. If you have anything related to the brain or in the spinal cord, anyway here, the tract, that is called upper motor neuron lesion. So upper motor neuron lesion from the brain, it may be in the brain also or it may be in the spinal cord also. Up to the motor neuron relay, if any event happens, that leads to a paralysis. That is called upper motor neuron type of paralysis. Okay. Most commonly it occurs in the brain. Sometimes it can happen here. So most commonly it occurs in the brain, in the internal capsule it will happen. That is called upper motor neuron. And lower motor neuron means outside this motor neuron if you have a palsy. Now facial nerve is coming out. From this facial nerve nucleus it is coming out. After it comes out, if it got affected, that palsy is called element type of palsy. If we have the lesion on the brain, it is called UMN type of palsy. Okay, note the change between UMN and element. Okay, now what are the features of this Belsar? What is type? There is absence of wrinkling. So absence of wrinkling of the forehead. Absence of wrinkling in the forehead. Why? Because we got, if we do wrinkling, no, we got a muscle here called occipitofrontalis, frontal belly of occipitofrontalis. That first itself I told you, facial nerve will supply all the muscles of facial expression. So if my right side is paralyzed, I will not have wrinkling on my right side. So that is the absence of wrinkling. Then what happens here? He cannot able to close the, he or she cannot able to close the eyelids. Okay, because eyelids are supplied by a muscle called orbicularis oculi. Orbicularis oculi, which will be paralyzed here. So he cannot able to close entirely, he cannot close. Okay. So if he cannot close, what will happen? The tears will come out. It's called epiphora. So tears will come out. So absence of wrinkling, then inability to close. Inability to close the eyelids. Close the eyelids. Okay. Then there will be loss of wrinkling here also. Then there will be deviation of angle of mouth to the side. Okay, it will be like this. So there will be a deviation of angle of mouth, and because of this they can, and especially in this part there is a muscle called buccinator. So buccinator is a muscle which is helping in our chewing part. If the facial palsy is there, what will happen? He cannot able to chew. So there will be collection of food particles here, and there will be drooling of saliva. So drooling of saliva and inability to chew. Drooling of saliva and inability to chew. So all these features will happen in the case of Bell's palsy. So what is inability to chew the food and inability to close his right eye. Okay, so it's not related to anywhere related to the trigeminal nerve. If you have muscle paralysis in the face, most commonly it is a type of element type of palsy. Element is lower motor neuron type of palsy, that is facial nerve palsy, or is called Bell's palsy. What is the treatment? We can give steroids, corticosteroids, and the facial nerve facial physiotherapy can be given. So that type is called facial palsy. So it is slightly different from the hemiplegia UMN type of palsy. Okay. Now one more simple question, but I cannot get into detail of this. We'll try to see the location alone. Just a recap. Okay. A 20-year-old man present with a painless fluctuant swelling on the lateral aspect of the neck along the anterior part of the sternocleidomastoid. The swelling has been slowly increasing since adolescence. This is a catch here. Slowly increasing since it's not a tumor. It's not a sudden inflammatory swelling. It is a gradually increasing swelling. Swelling is most commonly radiated from which branchial cleft? They are directly asked branchial cleft. Branchial cleft are nothing but we got branchial arches, branchial. So this is not brachium in the arm. This is branchial. In the neck, we got some embryological swellings. When the neck is developing, there were embryological swellings. They are called branchial pouches. Okay. It's called branchial apparatus. The neck develops, okay, if you have like this, must have seen in the embryology books. So it will be like this. So how many will be there? So there will be 1, 2, 3, 4, 5, and 6. So there will be 5 branchial things. The fifth arch will disappear. They are called branchial arches. How many arches are there? We have branchial arches, 6 arch, 5th arch will disappear. So we got 1, 2, 3, 4, and 6. So how many arches are there? When we see on the outside, it is called arches. Okay. When we see on the inside, so there are arches like this. Okay. Inside, it will be appearing like a pouch. You can imagine like this. An arch is there, but if you view it from inside, from behind, how it will appear, it is called pouch. From inside, we call it as branchial pouch. From outside, we call it as branchial arch. Okay, this is branchial arches and branchial pouches. Derivatives of branchial arches, derivatives of branchial pouches itself is a question. We will cover it with a separate topic. Okay, it's a very large part. We cannot have it as a family discussion. Now, the question can come about the remnant of this. Now, drawn a diagram to show just the cyst. Okay. Now, if you have a branchial cyst, there are some obvious location. Now, this location, this is here. If we have a location here, this is all the embryological remnants. The thyroglossal duct. Okay. So, this is a location for a dermoid cyst. Common location for a dermoid cyst. This is a location for a thyroglossal cyst. As I have told you that thyroglossal duct is there. From the tongue, there is a duct which goes and then form a gland. Now, if you imagine the thyroid, the duct persists. Usually, duct will disappear. The duct persists, it will form a cyst here. That cyst is called thyroglossal cyst. The thyroglossal duct will persist. Thyroglossal duct is persisting, and it is now fluid is getting collected. It is forming a cyst. That is called thyroglossal cyst. Okay. Now, what is the characteristic feature of this thyroglossal cyst? You will learn in surgery. This cyst will move with deglutition. Why it is moving with deglutition? Because what is deglutition? When you try to swallow, you ask the patient to swallow, the tongue is moving. When you try to swallow, what is happening? Our larynx, okay, is going upwards. Or in other words, this duct is getting pulled in the tongue itself. So what will happen? There will be moves. This swelling will move up. So this is a characteristic feature. A swelling is appearing in the midline of the neck. The MCQ can be a swelling is appearing in the midline of the neck, and it moves with deglutition. Deglutition is swallowing. So deglutition, the answer is thyroglossal cyst. Okay. Now, if you have a given in the option, a small sinus is present in the lower border of sternocleidomastoid. So this is sternocleidomastoid. Sternocleido. We got a process here. It's called mastoid. Sternocleidomastoid. So if you have a swelling there, not a swelling, a sinus. What is sinus? If you have a globular part, that is called a swelling. If you have a tract like this and then going like this is called a sinus. If you got a same tract, but the two ends are opened out, that is called a fistula. So these are surgical parts. This is called swelling. This is sinus. Sinus means what? A blind end. Usually it is a blind end. Even our ear and our paranasal sinuses are like a blind end. So one end is open, other end is closed. It's called sinus. So if we have a sinus-like structure here, usually it will be a branchial sinus. Branchial sinus. Now, if you have a swelling on the anterior border of sternocleidomastoid, it's almost in the midline. This is a remnant of second branchial cleft. Okay, in the same option, if it is there in the almost somewhere here, it can be the third branchial cleft. So in the option they have given a swelling in the parotid region is commonly a third branchial cleft remnant. Swelling on the anterior border of sternocleidomastoid will be a second branchial cleft. A sinus is there in this, that is also a remnant called branchial sinus remnant. Okay. And sometimes the question can be, we got a small sinus in this in front of the ear. What can we call it as? We call it as preauricular sinus. This is called preauricular sinus. Preauricular sinus. So swelling in this floor of the mouth is usually a dermoid cyst. The flooring in the anterior middle part of the midline, which moves with deglutition. that is a thyroclossal cyst. Lower border is called the branchial sinus remnant. Anterior border of sternocleidomastoid is second branchial cleft. If the swelling is somewhere here near the parotid region, okay, that is usually a third branchial cleft. And in front of the ear, you are feeling a sinus. That's called pre-auricular sinus. So that is what is given in this other picture also. This area is mostly second branchial cleft and pre-auricular sinus, and then third branchial cleft. So this is the embryological question related to this part. What is the option given? In the question itself, you can see the catch clue is the anterior border of sternocleidomastoid. It's not first, second, third. It is the second branchial cleft that will usually form a swelling on the anterior border of sternocleidomastoid. Now we'll just see the part which we covered in the initial part of the class, but there was a loss of sensing. So I'll try to cover some topics and some other extra points. If I want to say, I can say this. Okay, we'll try how much we can cover.